Good day, ma'am. I am GSDMSFI ASAT BSN2C. Now, I will demonstrate to you on how to insert catheter for our female client. So, our assessment, assess the client overall condition, determine if the client is able to cooperate. Determine the client when client last voided or was last catheterized. Percuss the bladder to check for fullness or distension. Assess for redness, excoriation, skin breakdown, odor, pain, or discomfort. Assess for the discharge, drainage, and any localized area of tenderness. So next is for the planning, verify the physician orders, prepare the client in the materials, perform routine perigenital care as needed. Prior to catheterization, follow procedure on perigenital care. Next is prepare materials. The materials needed is sterile catheter of appropriate size, catheterization kit or individual sterile items, 1 to 2 pairs of sterile gloves, sterile square sheets, cotton balls with betadine, sterile gauze, forceps, water-soluble lubricant, urine receptacles, 10 ml syringe pre-filled with sterile water, drainage bag for urine, specimen container, lamp or flashlight as necessary, hypoallergenic tape and safety pin or clip, disposable clean gloves. Next is bath blanket for tripping the client, soap, washcloth and towel, basin or warm water, 43 degrees Celsius and 46 degrees Celsius, bedpan and dipper, rubber sheets, unfilling syringe with sterile water, put on sterile gloves at the dominant hand, then hold the syringe as aspirate the sterile water while the non-dominant hand stabilizes the container. Next is for the implementation. For the catheterization, first introduce yourself and verify the client identity. Explain to the client the procedure, why is it necessary, on how the client cooperate. Reassure the client that he or she might feel a little discomfort during the procedure. Inform the client that the urge to void will disappear. Good morning po, ma'am. I am GSDMSFI ASAT. I am a student nurse. Now I'm going to assess to you for our return demonstration. We're gonna be inserting fully catheter into your bladder today. Is that alright? Okay. If you have concern or discomfort while assess you, tell me so that I can assist you. Okay po, ma'am? Okay. Next is perform hand hygiene. You can do hand washing or you can apply alcohol. Provide for the client privacy. Place the client in the appropriate position. Supine with new flex feet about 2 feet apart, thighs externally rotated if possible. Place waterproof pads under the buttocks if you do the peridial care. Cover the client chest and abdomen with bath blanket. Pull the client's gown up and over the hips. Cover the legs and thighs with St. Mary's dripping techniques. Establish the adequate light stand on the client's right if you are right-handed, on the client's left if you are left-handed. Open the package of drainage bag and place the tubing within bridge and hang the bag below the bladder or under the bed frame. Do not allow it to rest on the floor. Ensure that emptying valve is closed. Next is prepare the sterile field. Place the sterile Place the sterile drape between the legs. Put on sterile gloves in the following sequence. First, single gloves, dominant hand only. Gloves hand picks up the sterile syringe and fills it with sterile water, while ungloved non-dominant hand holds the bottle of sterile water. And then wear the second glove. the prefilled syringe to the indwelling catheter inflation valve. Touch the balloon if the balloon rings does not fully inflate. Replace the catheter. Next is lubricate the catheter for the females 1 to 2 inches and place it with the drainage and inside the collection container. Cleansing of the vulva using the non-dominant hand. Cleanse the meatus. Non-dominant hand is considered contaminated. Once it touches the client's skin, use your non-dominant hand to spread the labia. Establish a firm but gentle position. The labia must not be allowed to return over the cleansed meatus. Your dominant hand, using the sterile forceps, pick up a cotton balls, wipe one side of the labia majora in an anterior-posterior direction. Use a new cotton balls for opposite side. Repeat the procedure for the labia minora. Use at least 2 balls to cleanse the meatus. Wipe in anterior-posterior direction. Do not contaminate the sterile hand. Location of the urethra meatus is the best identified during the cleansing process. Place the sterile eye sheets Hold the catheter firmly 2 to 3 inches from tip. Ask the client to take a slow deep breath. Ma'am, could you please take a deep breath? And insert the catheter as the client exhale. Exhale po, ma'am. Slight resistance is expected as the catheter passes through the sphincters and advance the catheter 2 to inches further after the urine begins to flow through it for the female. For males, some agency policies procedure to advance the catheter to bifurcation of the catheter. If the catheter is accidentally contaminated, a new sterile catheter must be used. Collect a urine specimen as needed. Allow to 20 to 30 ml to flow into the specimen container. Close lid. Inflate the retention balloon with the volume required by the catheter manufacturer. Hold the inflation valve between 2 fingers of your non-dominant hand while you attach the syringe and the inflation valve and with your dominant hand. If the client complains of discomfort, immediately withdraw the instilled fluid. Advance the catheter further and attempt to inflate the balloon again. Remove the syringe. Pull the catheter the drainage and of the catheter to the collecting tubing and valve. Secure the catheter tubing with non-allergenic plaster, giving it enough to slap to allow you movement at the inner thigh for the female clients, at the upper thigh or abdomen for female clients. Fold the tubing and secure it with clip at the bed linen beside the client, maintaining a straight line down to collecting valve. To establish, use the gauze pad to wipe the perineal area of the any remaining antiseptic lubricant liprace for the skin of retracted earth. Remove one glove, cover genitals, and place the client to a comfortable position, and throw your gloves and with another hand gloves with the dirtiest for proper disposal, and you throw your gloves to the proper disposal. So that's all for the catheterization.